Well, I work at the University of North Dakota, and I do research on renal disease and bladder cancer. So when I was 39, I smoked 4 packs of cigarettes a day. You know, that's not a good thing to be doing, and I just dropped over right in the middle of the research wing.
Fortunately, I was there and could start CPR.
I was in a coma for a while, about 7 days. I figured, well, can't do this anymore the way I did it before. So I figured, okay, I'll get rid of the cigarettes. I'll get rid of the temper. I'll keep the research, and I better get in shape. So I got a treadmill, and I've done that for 32 years. Went to a local hospital and got a cardiac cath, and I never did quite understand what the doctor was telling me, except that he was totally alarmed. He said, there's only one person I know of that can help you. And he says, you know, this is Dr. Balakis. He said, he's the only one that does this. And he says, there's not very many people in the United States that can pull this off.
This patient, I had seen the angiogram because the referring physician examined the angiogram before and asked me whether I would be willing to consider it. And I said, doesn't look good, but I would be happy to talk to him.
And first time I saw him, he walked in and looked around and said, who's the patient here?
It was surprising to me how well he looked, despite how difficult and how complex was his anatomy and his artery being completely blocked.
We talked a little bit, and he finally said, have you seen your scan? And he came in with a scan, and there was absolutely nothing showing up in the left coronary artery.
You know, I was very concerned. I'm a physician, I'm a forensic pathologist. I see people with less cardiac disease die every day.
Heart function is down, so we know that the risk is substantial. And for many patients like this, you always have the conversation with them that, look, we can try it, but this may be the end.
And that's the point that I knew that good chance here I should be dead. I mean, you're not supposed to be alive with this. This is what's called the widowmaker, you know, so I'm running around without one.
I mean, there was just this knot in your stomach. You just said, you know, this is going to end. You know, he's going to die. I was hoping we could get one artery open and get a few more years.
He had a complete left main occlusion. Everything was filling from the other artery. His heart function was significantly decreased. So there was a significant risk that if we did something to the other artery, which we had to go through to visualize and get through and open up the blocked artery, that would be the end of it, essentially. So that was quite stressful, to say the least.
I don't know, I'm told I set a record for how long I was in a cath lab, but this is the most amazing thing you've ever seen. So I came out of there, you're still a little groggy, and Mary Ann had this scan, and she says, look at this. She says, he opened up everything.
I was just absolutely floored when I saw the final angiogram. Everything was open.
But the best part of it is seeing his heart function improve afterwards, because sometimes you don't know. You get the flow, but is the heart going to respond? Is it going to get better? And there was some improvement in his function, and especially the way he was feeling when doing his exercise. So this is the best part, that actually it's not just the procedure being successful, it's him getting the benefit of it on a real time, on a day-to-day basis in his everyday life.
It all worked out great. Got home, got on a treadmill. I was back to everything I've ever done, plus better. It was true, though, what the heart failure guy said, and that he says, you may not know how bad you feel till you feel better. And that was true with this.
The goal of the Center for Coronary Disease is to make the impossible possible. And actually, in his case, he was turned down by many other people because the risk involved was substantial and many people didn't want to take it on.
It just was beyond expectations. And the people were really nice here, too. It's a wonderful place. to get medical care.